When you get injured, how do you know who to see?
Oh, God!
Should you see a medical doctor, a physical therapist, or a massage therapist? Most people either guess wrong, wait too long, or bounce between everyone hoping something sticks. Let's clear that up today. Hi, I'm Dr. Justin Lin, Doctor of Physical Therapy at Rehab and Revive. We'll get to that answer shortly, but first, if this video helps you at all, please like and subscribe and consider hitting the thanks button and donating. We've also created Revive at Home programs, which you can find in the description spots below. We appreciate your support. Think of pain like a car problem. Let's break this down simply. If your car makes a noise, you don't automatically replace the engine, get a paint job, or ignore the warning light. You ask, what system is failing and how serious is it? The same logic applies to your body. When to see a medical doctor or MD? MDs are there to rule out danger. You should see an MD first if you have significant bruising or swelling, an inability to bear weight, or sudden loss of strength or sensation. You should also go if there is a deformity, obvious structural change, or if you experience trauma like a fall or car accidents. Watch for red flags like fever, night pain, or unexplained weight loss or numbness that is spreading. The rule of thumb is simple. If you're asking, did I break something or is this dangerous? Go to the MD first. They are there to order imaging, rule out fractures and infections, and clear you for rehab. MDs diagnose disease and manage risk, but they are generally not designed to restore movement long term. When to see physical therapists, PTs. PTs restore function. You should see a PT when pain has been around for weeks or months. If you know how it started or if it keeps coming back, if you've already been told nothing is wrong or your imaging shows something but no one explained what to do about it, a PT is your next step. The rule of thumb here is if pain is limiting how you move, live, or train and you want to plan, see a PT. We connect symptoms to movement patterns, identify why the issue keeps happening, and build a progression to actually fix it while reducing your dependency on passive care. This is especially true for chronic pain, overuse injuries, and post-surgical rehab. When to see a massage therapist? Massage therapists are tissue specialists rather than movement strategists. They are a great resource when you're dealing with muscle tightness, stress-related tension, or recovery between training sessions. They are also helpful if you already have a diagnosis and a plan from another provider. The rule of thumb for a massage is if you're saying, I just feel tight, massage is appropriate. However, if you're saying, I don't know why this keeps happening, massage alone probably won't fix that. Massage helps symptoms, but it rarely addresses the root causes. The biggest mistake people make too often is that people pick care based on cost, convenience, or whoever they've seen before. Instead, you should be asking, what system is involved and how severe is this? Pain doesn't necessarily mean you need more care. It means you need the right care at the right time. How we think about it at Rehab and Revive is we believe in ruling out danger first, restoring movement second, and using hands-on care strategically rather than endlessly. When done right, these providers work together instead of against each other. If this helped clarify things for you, let us know and leave us some love or questions in the comments box below. Please like and subscribe. We truly appreciate your support. I'm Dr. Lin. Remember, we heal smarter.